Thank you, Congressman Abercrombie, and thank you all for coming out tonight. I'm honored to be a part of the panel. I don't mean to speak for my colleagues, but I would like to share a little bit of the perspective of the School of Medicine and what we're trying to achieve in the state of Hawaii. I have two key points, so I'm just mention them up front, and then we'll reiterate them a bit in the 3 to 5 minutes I have. First is...
In the 3 minutes.
3 minutes. First is workforce, and the second is basic level of care. In regards to workforce, we cannot deliver health care to all without an adequate number of practitioners. And this is true across multiple disciplines, multiple professionals. And we have challenges here in Hawaii where we have the 7th oldest physician workforce in the nation, where we have a median age at the Hilo Medical Center of 56 for the practitioners, where I spoke with a number of the members of the audience yesterday. It is a challenge, and you play that forward a decade, and we're going to have significant challenges. These exist across Hawaii, but of course are at the moment most acute in our neighbor islands. Some of my colleagues have done a study that show that currently for the amount of work that's being done, we're about 13 primary care physicians short on the Big Island, 5 cardiologists, 2 orthopedists, 2 general surgeons, and 5 psychiatrists, fewer than what our peers elsewhere in the U.S. have deliver the same amount of health care. So we have a concern that if we can create a good, strong insurance program providing opportunity for medical care, how do we deliver that when we don't have the workforce? And so expanding that, expanding training opportunities, and trying to do as much of that on the neighbor islands and a multi-professional training opportunity is where we're trying to go. And I won't elaborate on that for the purposes of time. The final point I want to have us think about tonight is we want to expand care and health insurance for all, but as we do that, can we really do all things for all people? How do we bring the community together to prioritize and set the basic level of care that we want all to receive and create that opportunity? Because if we do try to deliver the wide range of potential care to all citizens, I don't know how we'll find a way to do it. So let's give that some thought. Thank you for the opportunity to speak.
Thank you, Dean.